लिंक कर रहे हैं।
चल रही रिकॉर्डिंग। कार्ड कौन सा है?
ठीक है,
ठीक है डन।
गाड़ी निकल जाएगा। करने दो, ये कभी भी करो ना 10 सेकंड तक करो, 10-15 सेकंड भी चलेगा। चलो अब एक काम करना, इसके बाद नीचे बताओ। 15 हो गया, फिर 2 सेकंड हो। चलो काटो।
I'm Dr. P.S. Nayyar. I'm a physician and medical superintendent of this hospital. I'm Dr. P.S. Nayyar, consultant physicians and medical superintendent of Sanjay Gandhi Memorial Hospital. I'm Dr. P.S. Nayyar. I'm a medical I'm Dr. P.S. Nayyar. I'm medical superintendent and consultant physician of Sanjay Gandhi Memorial Hospital. It's a Delhi government 300-bedded hospital, and since January last, it has been a COVID hospital. This hospital has been taking care of all the COVID patients, not only their diagnostic aspects, but their immunization and rest of the things. We have gone through a different kind of a phases in last 1.5 years. When we had this COVID in month of March, we had a few cases, gradually they increased. There have been a small spikes and coming down in the number of the cases. We managed all the episodes which has happened during the last 1.5 years. But this time, this is the second spike which has taken us, every one of us, to a surprise, because this spike has come without giving any alarming signs. This spike has given suddenly a large number of cases to in the hospitals, and this has also given rise to many serious cases in the hospitals. This has led to all the hospitals getting saturated by the patients. There has been a patients which has been lying waiting to get admission. There have been a patients which has been waiting outside the hospital premises so that this can be admitted. Fortunately, this situation has not come in my hospital, but some of the hospitals in Delhi, this situation has been seen with us. This number of the cases has taken a surprise, in the sense that possibly we were also not prepared for it. The number of the beds has been less, the amount of the patients which are coming. There has been a crisis where there has been a non-availability of the oxygen to us, but this has been managed, the crisis has been managed very nicely. This oxygen flow, the supply chain has improved a lot, the tankers has been imported, the cylinders has come into action, and we have been able to manage this crisis very nicely. There has not been any situation where this hospital in particular has come a situation where there is no oxygen or there is no shortage of the beds. All the times we have the beds available for the patients which has been approaching us. We have been able to manage all these patients nicely. Of course, mortality is high this time, but all the drugs which was required for this patient, including the antiviral drugs or plasma, everything was available in the hospital. This corona and the COVID epidemic has put a lot of stress on all of us. all the doctors, nurses, paramedical staff which has been working has worked this time under a lot of stress. It is that stress has come because of the number of the cases, the number of the serious cases, the number of deaths which has increased this time. All these people, the staff which has been working here has gone through a mental stress also, because there has been at times there is a long duration of the duties, long durations we have been standing in the PPE kits. All these difficulty faced by the medical as well as the paramedical and the nursing staff during this crisis. Now the situation has improved. We have increased further more and more beds has been increased all over Delhi. So is the same applies to our hospital also. More infrastructure has been created today in form of a more number of a ventilator, more number of a beds, more number of BiPAPs, oxygen concentrator. This has helped to relieve a pressure on us. And all the staff has been, all the 3 shifts worked very, very hard during this crisis. As regards the food and water, everything was we planned to give it to these people during the duty. We have already done in the past, and this time also we are implementing this that all the food and water and everything what is required for the people working in the hospital should be provided with it. This pandemic which has come during the month of April and continuing this May 2021 has taken us, all of us, in by surprise. The surprise taken by the sheer number of the cases. Suddenly the large number of the cases has come to us, but fortunately we were able to handle this crisis in a very, very efficient manner. There was no deaths because of shortage of the oxygen or shortage of any equipment. All the equipments and treatment was available to the hospital. The whole team was efficiently working with us. Whatever medicines were required, they were available for the patients, and we provided that medication.
How do you try to avoid it or find solution for it?
Okay. This time, when this patient has come, we have made a special arrangement. A triage area at the beginning has been created, a help desk has been created for the patient, and a facilitation center has been there, so that even the relatives we have taken care of. Anytime the relatives are coming, they are anxious, they want to know the details of the patient. We have been able to provide them all through the help desk. Once the patient is received here, we are received at the facilitation desk, and after that the doctor examines and put them in a different categories, whether to the ICU or to the ward on oxygen. This time we did not face much of a problem, except that the small few days we had a supply problem for the oxygen, as there was a less supply was coming from the oxygen. But unfortunately we did not went into crisis, although supply was less, but we were able to manage all the cases during this.
What are you doing now, critical cases? Do you have sufficient medical devices and equipment?
Now we have a sufficient monitors, sufficient ventilators, all the devices like BiPAP available to us. In the beginning we have a little small number, but now everything is available in abundance.
Many people accuse the Indian government of failing to prepare for the pandemic. What more could the government have done and not?
See, the government has done a very good job, whether you are calling about a state government or a central government. Since this has been taken as a surprise to us, the numbers has suddenly increased. So there was a delay in getting the equipments. But the governments, both the sides, has done wonderfully, and all the things have been made available to the clinician, whether we are talking about the drugs, whether we are talking about the ventilators, or we are talking about the BiPAPs in the management.
The government is also accused of having a role in the spread of the epidemic. To what extent is this true?
See, I'll put it that way. There has been a certain activities which we should not have had, like gathering of a large number of a people, like we have this large number of the people getting collected during the elections or during a celebrations or a kumbh, whatever has been there in Uttarakhand. If we had not done with those things, the number should not have increased.
How do you relate the pressure and its impact on the medical staff?
Well, I'll tell you, the stress on the medical staff is very, very high. All the time standing and working on toes and looking at the number of the deaths. See, we clinician has not seen so many deaths at one time going simultaneously. The number of deaths in each shift, in each ICU has been 5, 6, 7, and which we really had not seen in the past. So this was a one, and when you see so many deaths in the hospital, definitely it puts a pressure on your brain also. You carry this pressure home.
Herbal remedies have appeared for corona. Do you think that it is also one of the reasons for complacency with the diseases?
See, there has been a certain different kind of a treatments other than the allopathic treatment for the corona, but none of them has been seen to be of any benefit as far as I am concerned. They claim that they have a benefit, but I am not very much convinced that any other medicine other than the allopathic will work for the treatment of corona.
What are the most difficult situation you went through in the past days?
Last few days, the most difficult situations were 1 or 2 days of a crisis when we had a very limited supply of the oxygen. The crisis became very serious to us, but fortunately we could get the oxygen just before that time where we could have a zero oxygen level, but fortunately we did not get through it. The other crisis which put a pressure on us is the large number of deaths which has been happening due to COVID. Many patients has been coming in a very, very serious conditions. We are admitting, and within a few hours to 24 hours the patients are leaving us.
Have you been personally affected by what is happening now? How?
Yes, definitely. Looking at the scenario, it has personally affected me also emotionally. My confidence has shaken at times when I have seen the situations where I am not able to do much to these patients.
Also to your family also.
So this has also taken up in my family also. My family is also equal stressful there. They also fear that I may carry infection from the hospital. So we had to talk to the families, make them convinced that yes, although we are coming from the hospital, but we don't carry the infection. We take all the precaution when we are entering in the house to disinfecting ourselves, taking a bath, and then reaching to the children and the family members.
ये भी बोल दीजिए.
Discuss this interview on any platform, be it in an Indian or an international level.
Thank you.
Thank you.
ओके
थोड़ा सा ये
नीचे करो
आँख भी ढकी ना.
ठीक है हेलो माय नेम इज़ डॉक्टर अनुराधा माइक को और ऊपर करो क्या माय नेम इज़ डॉक्टर अनुराधा आई एम वर्किंग एज ए ICUSR ओके
Introduce yourself.
माय नेम इज़ डॉक्टर अनुराधा मास्क और नीचे करो My name is Dr. Anuradha and I am posted as an SR in the Department of ICU and Critical Care, and I am working here from past 1.5 years, and I am attending COVID positive patients from past 1 year during the first spike of infection when there were a lot of COVID positive patients, and now also when India faced the second wave of COVID, when there was a huge population of people were getting infected and were coming to the hospitals at large scale.
What is happening in India now?
India is facing the second wave of COVID infection, in which the 3 new strains were introduced into the population, and people were coming, mostly the age group, middle age group, were falling into the infection group, and they were getting infection and then were presenting to the emergency of our hospital within 2 to 3 days. And the mass that was presenting into the hospital was so severe that we could not all at once tackle all the patients.
What did the country reach this humanitarian crisis?
I think the major reason for people to fall into the category where we had a huge increase in COVID cases was because not only the government but the population itself was not very aware and were very lenient towards the major protocols of to follow the major protocols of COVID infection, like social distancing and not wearing mask, and not following all the protocols like safety distance and cleaning and hand sanitization.
What is the difference between what is happening today and what was happening before, since the beginning of the pandemic?
There's no much difference. Instead of the fact that there were patients previously also and then there are patients right now, the situation remains the same, except for the fact that in the previous time we were managing at once a very tiny small group of population, but right now every other patient who is coming into the hospital is presenting with the symptoms of COVID, and most of them are turn out to be COVID positive.
How long have you been working? Have you taken time to rest?
I am working from past 1 year in this hospital, and during this critical time when everybody is working as much as they could, I have been working consistently without much gap. But yes, the good part about my job is that I get after 24 hours of shift, I get a 2-day off.
How did the health system collapse? What the reasons?
We were resourced, like for every patient, the resources that were required to tackle the patient, to take care of and to treat those patients were minimum. At a minimum, we were getting 100 of patients a day in like 2 or 3 hours. So the management needed more manpower and more resources, which were not available because we didn't know that we will be facing so much huge population who will get infected to COVID.
Do you work within a strategic plan to deal with patients?
Yes, we made sure that we must never run out of oxygen. In spite of all the precautions, there has been time that there was less of oxygen, but it never happened to us that this hospital or any of the patients admitted to this hospital falls shortage of oxygen. Never happened.
Are you able to receive all the cases that arrive to the hospital?
Right now, most of the cases that came to the hospital who needed urgent intervention or urgent treatment were attended by the doctors who were present in emergency respective, and they all were attended well. None of them were returned back to because of lack of beds or oxygen.
Do you give priority to some patients over others, and within what consideration?
Right now, we have implemented the triage in our emergency where the patients who need most care fall into one category, while the patient who needs less care falls into the other. So we have categorized the type of patient under the different categories, and we treat accordingly.
Was there no plan to confront this wave, or was it big and unexpected?
It was unexpected. We weren't expecting such a huge, it was a war-like situation for us. We actually had to deal with a large number of population who were coming to us every day for treatment and who were falling into COVID infection. We somehow managed to combat the infection and the situation we were fallen into.
What are the most complex problems that is suffer from these days?
The most complex situation was the number of populations who were coming to hospital was huge, and resources and hospital beds were less. So we had to increase the number of COVID beds by discharging the patients who were already in the hospital, who did not need any active intervention, and then ready. While managing those patients, the most challenging thing to do was to maintain the saturation of oxygen. Whoever needed oxygen should be given the amount of. While we were treating those patients who came with the COVID infection and COVID symptoms, the main challenge for us was to.
What are the most complex problems?
The most complex situation, the challenge that we faced while treating those patients was oxygen shortage. Despite of the fact that we had all the resources to provide oxygen to all the patients, we were falling shortage of oxygen cylinders, and there was active intervention for taking care of those shortages. Like whenever we got to know that the patient is needing oxygen and there is a shortage for the oxygen supply, we made sure that the person or the patient should get oxygen, but within a limited quantity which will keep the patient alive. So yeah, for every single healthcare worker, frontline workers, it was very important that the oxygen cylinder should be in stock and it should not run out. And thankfully our patients, whoever were admitted in our hospital, no one lost their life because of oxygen shortage.
What is the nature of the oxygen crisis? How do you try to avoid it or find solution for it?
The situation is quite worrying, and it has to be understood that the patient that are coming to the hospital setup needs oxygen at a larger scale, and yet we have obviously implemented the sources which will not create any oxygen shortage, but the same should be done for every hospitals around.
Many people accuse the Indian government of failing to prepare for the pandemic. What more could the government have done and now?
Yes, the government was not prepared, and the government, when the government has to put their concern towards the main agenda, which was to take care of the patient, the dying patients who were dying at the roadsides and because of lack of oxygen or because of there were no beds. The government should have made more hospitals and would have implemented more of doctors. And I don't just blame the government, but it was our leniency also, the leniency towards the protocols which was to be followed by the population in order to not get the infection.
The government is also accused of having a role in the spread of the epidemic. To what extent is this true?
Not a role, but I would say the failure. Vaccines should have been given at a prior time. The gap must have been reduced. Everyone must have been vaccinated within the time period. But since we were out of vaccines, so yeah, this created a lot of nuisance among the population.
How do you evaluate the pressure and its impact on the medical staff?
It's huge, and it's at the same time it's very heartfelt that whoever is working in the COVID setup, they are mentally and physically drained. Like wearing PPE all the time and then attending the patients without getting break to eat or to get freshen up takes toll on the mental and physical status. Most of us went to we face mental breakups where the person who is attending the patient is not able to give the proper utmost care or treatment, or the patients are dying in front of us because we could not do much because the infection was so severe and it causes so much damage to the patient's condition that we were out of help. Even though the treatment was apt, the patient could not be survived, and then we could not salvage the patient because patient's situation was worsening day by day.
Herbal remedies have appeared for corona. Do you think that it is also one of the reasons for complacency with the disease?
There are other remedies apart from allopathy, but they don't prove 100%, they don't provide 100% security from the disease. There is prophylactic. Once the patient doesn't have the disease, they can take to boost the immunity, but those remedies don't cure the infection. The curity of infection, actually the most of the drugs that are being used are under trial.
What are the most difficult situation you went through in the first day?
The most difficult situation for us was to provide bed for the every patient that was coming to the hospital. We had to manage which patient to send where, into which cubicles, into which zone, whether the patient needs ICU care or the patient needs normal general ward care. We were not aware, because a patient who is coming to us walking suddenly tends to deteriorate and fall into the category where the patient needed intubation and mechanical ventilation. And then there were people who came with breathing difficulty, and we provided with oxygen and they improved. So the challenge was to put the all the patient into category where one should get proper treatment and all the necessities that were needed at the time.
Have you been personally affected by what is happening now? How?
I was very disheartened with the situation. I saw people dying. There were few casualties at my duty, on my duties, and it was really tormenting for me. It taken a toll on my physical and mental status. But I knew that I have to stay strong and I have to follow all the protocols, and I have to take care of myself also and the patients whom I was treating. So overall it was mentally affecting me, but I had to deal with it, and I had to make sure that all the patients who are being treated by me should not go unnoticed. I agree to broadcast this interview on any platform, be it Indian or international.
Thank you. My name is as a nursing officer in this hospital since 2010. हेलो हेलो मेरा नाम प्रीति है. ये रखिए.
Introduce yourself.
My name is Preeti. I'm a nursing officer. I'm working in this hospital since 2010, and now I'm working in this ICU since past 1 year.
What is happening in India now?
These days, this pandemic has spread all over country, all over world, and it has become a huge problem for everyone. And it is a really difficult time for us because we have never seen such a big issue which is all over the world, and now it's becoming very difficult times for everyone.
Why did the country reach this humanitarian crisis?
This crisis has because of the negligence of the people, because people do not believe, they just don't accept the situation. They do not maintain this maintain the, they don't wear mask, they don't follow the guidelines which are the government is issuing.
What is the difference between what is happening today and what was happening before, since the beginning of the pandemic?
Since the beginning, as we were new to this condition, this problem, we are not aware why how it spreads, and the treatment was not available for this condition. But now the people are more aware about the condition, and they are tackling with this situation, and the hospital, the management, everything is struggling hard to manage this situation, this pandemic situation. And yes, there is a difficulty because nowadays it has become very difficult to tackle. So yes, there is a huge change in it.
How long have you been working? Have you taken time to rest?
Yes, I'm working in this hospital in shifts. We do get time in between, but it is become so hectic as compared to previous time.
Do you work within a strategic plan to deal with patients?
Yes, there is a strategy. We do use PPE kit. We take precautions while we are approaching to the patient. We are taking care of the patients who are suffering from COVID disease. So yeah, there is a strategy, because without strategy we cannot fight such a huge pandemic.
How did the health system collapse? What the reasons?
The pandemic disease has come all of the sudden, so it has become very difficult for every the medical profession, and the our manpower has become less, and the patient are increasing the number of patients increasing day by day. So it has become very difficult for us to manage the things. But however, fortunately we have developed the condition and manage the patient.
Are you able to receive all the cases that arrive to the hospital?
In our hospitals, however, in the beginning it was difficult for us to manage the patients, to take all the patients. But yes, on the priority basis, the patients who need urgent requirement of the beds, we admitted those patients and we treated them. And but for the patients who can be isolated at their home only and they can be treated on the oral medication only, so we accordingly manage those patients.
Do you give priority to some patients over other? And within what consideration?
Yes, when patient comes to us, sometimes they are in a very difficult condition, in a very problematic condition, then we have to admit them on the priority basis, as I have told before. And the patients who can be managed at home, definitely we advise them to be at their home only, so they are isolated at their homes.
What are the most complex problems that you suffer from these days?
The complex situation is that the patients are dying in front of us because of they are reaching the hospital sometimes very late. So it becomes for us very difficult at times to manage them. So this is the problem we are facing now.
What is the nature of the oxygen crisis? How do you try to avoid it or find solution for it?
Yeah, in between, when the number of patients has increased so far, so it has become for us a little bit difficult. But our hospital have managed the oxygen level, and we have never reached to a zero situation when the oxygen was nil. We have never reached to a condition.
What are you doing now for critical cases? Do you have sufficient medical device and equipment?
Yes, in our hospital, according to the patient, to treat them, we have all the medical equipments like ventilators and the oximeters and everything we are having to treat the patients.
Many people accuse the Indian government of failing to prepare for the pandemic. What more could the government have done?
Well, in Indian government has done a tremendous job in this situation. They have managed this condition very well, like imposing the lockdown, providing many hospitals. They have arranged so many manpower. They have arranged, and so they have well managed.
How do you evaluate the pressure and its impact on the medical staff?
Due to the increased number of the patients, it has become little difficult for us, but we are managing it. On the times we are doing the double shifts and triple shifts, and workload definitely has increased on the medical staff, but we are dedicated to our profession, so yes, we manage.
Herbal remedies have appeared for corona. Do you think that it is also one of the reasons for complacency with the disease?
Yes, because according to me, I don't believe that this helps and it is a remedy for corona, but many people believe and they do take the treatment, but according to me, it's not of use.
What was the most difficult situation you went through in the past weeks?
In the past days, I have seen a number of patients coming to our hospital. Yes, we are treating them well, but sometime when the patient come at very last stage, then it becomes very difficult for us to treat that patient. So it is really heartbreaking, and it is really very difficult times when we are facing such situations when a family member of a family is dying, and so it was sometimes terrible for us to see.
Have you been personally affected by what is happening now? How?
Yes, being a nursing professional, I'm coming to the hospital on the daily basis, and while going back to the home, I'm really afraid of my family getting infected. So I don't want to involve them in this situation because of me. So I really take precaution before going to the home, and after going to the home, I'll take bath and I'll just sanitize myself. So I have to take precautions to prevent my family from getting infected.
सामने देख के
I agree to broadcast this interview on any platform, to be it Indian or international. Thank you.
शुगर थोड़ा हायर साइड पे चल रहा है.
इधर मत देखिएगा आप.
टेस्ट भी चेक कर लो अपने अभी हो गया दे भी देते हैं
कुछ Myself Savita Sen.
पूरा इंट्रोडक्शन दे
Myself Savita Sen.
इंट्रोड्यूस योरसेल्फ
Sir, good evening. Myself is Savita Sen. I am working here since 2007 Sanjay Gandhi Hospital, and I am married, and it is a institute of it is a general hospital.
दोबारा बोलो ऑक्यूपेशन भी तो बताएंगे ना
अच्छा, ठीक है.
ठीक है
हाँ.
रिपीट कर दिए इंट्रोड्यूस योरसेल्फ
Myself Savita Sen. I am here nursing officer. I am working in Sanjay Gandhi Hospital in 2007, and presently I am working or posted in disaster ward, which is a COVID ward, and I am nowadays I am dealing with COVID patients.
व्हाट इज हैपनिंग इन इंडिया नाउ
In India nowadays, pandemic going on, as you all know, Corona or COVID-19 is spreading, just like second wave is going on since April.
why did the country reach this humanitarian crisis
Due to there are some more reasons, like people don't they are not using proper social distancing, they are not using proper masks, and there are lots of rallies are going on. They are going for the some historical places, or they are going here and there without using any SOPs. These are the reasons, so this crisis going on.
what is the difference between what is happening today and what was happening before since the beginning of the pandemic
Before pandemic, like in 2020